guys, I'm Chantal, your host for the Diamond Skin Beauty podcast. I've got Tiffany here today. She's a content creator for everything beauty and makeup. We're going to be talking about derma fillers, beauty and treatments in general. So Tiffany is those natural people. Well, when I say natural, as in she's unfiltered person. She's very beautiful, as you can see, and she's unfiltered. So welcome to a real life, in-person consult with Tiffany. Tiffany, can you tell our listeners about yourself?
I'm Tiffany. I don't know what to say really. I'm just a beauty enthusiast. I wouldn't say I'm a YouTuber anymore or a makeup artist. I've done makeup artistry for about 10 years. I did your makeup today.
Yeah, thank you.
You can follow me on my handles, which probably should be at the bottom over there. But yeah, she said I'm very, very unfiltered, very, very real. So you're going to get the real from me today. I'm literally going to not filter nothing just because, we know each other. So.
Yeah, so I've known Tiffany for well over 10 years. She's done my makeup on many occasions, some which are happy, some not so happy. But so Tiffany, makeup, how did you get into makeup and why makeup?
I don't know if I should send you a picture, of my first ever makeup that I ever did. It's so awful. And I even remember sending it to my friend Jen. She was like, Tiffany, don't you ever put eyeshadow again.
Oh my God.
Yeah, I used to watch loads of YouTube videos and stuff like that, yeah. And then I just decided to just go into it. Before I was kind of a tomboy and stuff, and then I just started doing my own makeup. Then I slowly started doing other people's makeup, but lightly. And then yours was my biggest ever makeup gig for the event.
Yeah.
So after that, that's how I got into it. And then after having a baby and stuff, I just thought, let me stop now. I just need some time for myself and my family.
Oh, so having a baby changed your attitude towards makeup and beauty?
Not necessarily. I still love makeup. I'll still have private clients like yourself and stuff that I would only do makeup for. But what I'd say would stop me kind of doing makeup was people just not wanting to pay the actual amount or delaying payment or just little arguments or discounts and stuff like that all the time. So it just made me just come out of it. But instead what I do now is I teach people how to do makeup now. So I'm still in it, but I don't actually do it per se.
Makes sense. Okay. Yeah. So if someone wanted to get hold of you to do a course, did they go and message you on Instagram?
Yeah, so just hit me up on Instagram on my DM and I'll respond. I'm pretty active. I'm very active on social media, so yeah.
Okay.
Instagram.
So aside from doing beauty, makeup, do you do anything with products, or are you into skincare? Is anything else? Are you into wigs? Right now is a wig craze. Everyone's got a wig. No matter if you're natural, most people do still have a wig. When I mean wig, I mean lace wigs and styling, etc. So what aside from doing makeup, do you do anything else in the beauty industry?
I could say I dabble in hair. I can do my own hair and I can do other people's hair, but I do my son's hair, but that's about it. I wouldn't actually go out and say, oh, I'm a hairstylist or anything like that. I think I just dabble in hair, so there's that. And I think that's it, other than that, I experiment a lot in new things, wanting to get my lips done and stuff like that, which is,
I think
the beginning of hell. It's a bad addiction, don't do it.
I think that we're on the subject of lips. I think everyone's looking at your lips and thinking how voluptuous they are. So
they're natural.
So I think they're how voluptuous they are. So, people love to get the lips enhanced and filler. Why did you do lip filler? Let's start off with the why and then how much filler. I think we'll progress into this question.
So why?
Yeah.
I just thought that my lips were small. I don't know, maybe it's something that's in your head, but I genuinely feel my lips were small, and there was that craze in the makeup industry where people were overdrawing their lips and using lip sucking tools to make your lips look bigger. And I remember when I used to do that, I used to like the look of how my lips would look. And then when I didn't have that, it was just I didn't like it, or my lips were too small, and then it started to build like something within me that made me want to actually just go ahead and just do my lips.
Okay, that's fair. So you did your lips for the first time. I think you came to Diamond Skin Clinic
Yes.
for the first time. How much mils did we put in?
We started off with 0.5.
Yeah, 0.5.
We started off with 0.5, and then I think the week after I came back and I said I wanted more. Was it a week after, I think, or 2 weeks, something like that?
I think it was less than a week. And we said no.
They were big, yeah, because it was swollen, and I liked the swollen look, yeah. Then when it went down, I was like, it's gone. I want another, and then I just kept getting more, and I honestly think I'm probably like on 8 mils on my lips, you know.
Please note, just for the listeners, she's only done 0.5 and 1 mil with us.
2 mils.
2 mils with us. So you put 8 mils of filler in.
Yeah.
Okay, why? Why have you done this? Do you feel they look natural?
I know they don't look natural, but like my aesthetic isn't the natural like look anyway. Like when I go out, for example, I'm expecting people to like my face, I'd say, is what is my marketing tool.
Yeah.
So like when people see me and my long eyelashes, oh, where'd you get your eyelashes from? Obviously today I don't have my extra long nails yet, but even my nails, that I'll go Tesco and I'm picking something up and someone will hold, like literally hold my hand. Like, are we forgetting that we had COVID not long ago, touching my hand? We'll be like, oh, your nails are nice, where'd you get in? And then like it's my promotion, like even with my lips. When I went Congo, because I've literally just come back, as you know.
Yeah.
Everyone was asking me about my lips.
Really?
They were literally like coming up to my face like, are they natural? Where did you get it from? Did you go Turkey? I'm like, no, I didn't go Turkey. I didn't go Turkey to do my lips. I didn't go Turkey. Yeah. Like even my mum's friends, like they're all interested in getting their lips done and stuff, but it's like I think that with Africans or like with black people, they just have this like, I don't know, this kind of complex that black people shouldn't do stuff like that. Like we naturally have big lips, but there's nothing wrong with enhancing it just a tiny little bit.
Yeah, that's true. That's true. That's true.
So like I said, my face sells. So, and I haven't had my cheeks done, so my cheeks are high, naturally higher.
So in terms of like procedures, what have you had done to your face? You just had your lips?
Just my lips. Yeah.
Oh, that's amazing.
But I want more stuff. I want more stuff.
So what is it that you'd like us to work on for you today?
So I'm battling between two stuff, and I know you're going to get on to me. Please. Please. Okay?
If she asks for lips, guys, please answer this question for us.
I wanted to get like 1 mil, just on my bottom lip, because I want my bottom lip to look a little bit like droopy, a little bit like... I think it's cute. Stop. I wanted like just a little bit, and then like on the cupid's bow to be a little bit more pointy. Yeah. So there's that. Or I was thinking to do fat dissolving here. Like, on the double chin bit.
Okay. Yeah.
But the only thing I'm worried about, that, which is good that we're having this conversation today, I don't think I've had this with you. Yeah. Will I get saggy skin down there if it's all gone? And how long until it's effective that it will show that like?
So I can actually answer these questions for you, but I definitely think this is time to bring in the expert. So please, guys, let's introduce Dr. Rola to the show so she'll be able to answer some of Tiffany's pressing questions about should she or should she not put an extra mil into her voluptuous lips, or should she work on doing a little bit of facial contouring with some fat dissolving along the chin line, or maybe she can answer Dr. about any other questions that she may have in mind. So let's welcome Dr. Rola to the show. Hi guys, so we've welcomed Dr. Rola back onto the show. So Dr. Rola, she has done her MBA, a master's degree in London in aesthetic medicine and dermatology, and she has over 18 years experience working in Kuwait as a dermatologist. So welcome her to the show. I think Tiffany has a few questions about whether she should do dermafillers to her lips or whether she should do some other treatments around the face. So Tiff's going to ask the doctor.
Yeah.
Ask the
expert. So I know that last time we did my lips and you was kind of concerned that they were already, Yeah. But I was saying to Chantal today that I wanted maybe to add a bit more on my bottom lip to look, make it look a little bit like bit more, and then someone like my Cupid's bow to be a little bit more sharp.
Would you like to know my advice?
Yes,
Yeah.
you have to be honest.
No.
So why no? So,
Because it's already nice. It's contoured. You have good volume in the upper and lower lips, so no need.
Not even a tiny bit. Not even a tiny bit at the bottom.
No, because it will look like more not natural, let us say.
Yeah.
It looks nice and it fits your face shape, so I don't think it's a good idea. Not now, maybe after 3-6 months
Okay.
we can add a bit, but I don't
But
think
not
so.
now.
Yeah.
And just another question. You see, if I was to ever think of dissolving my lips completely, would I have loose skin because I've stretched it so much?
Not that much. If you will apply a bit of dissolving hyaluronic days, you mean? No, it won't affect that much.
Okay.
Yeah, but as an advice, if there is no any problem with the filler, leave it to dissolve alone instead of injecting hyaluronides.
And how long does the lip filler stay in your lips?
Around 6 to 12 months, according to the product used. Okay, the concentration of the filler as well, the cross-linking of the filler. Yeah. So and the lifestyle of the patient. So if the patient is smoking, alcoholic, yeah. It's different. It will degrade or dissolve quicker.
Yeah.
Yeah.
Okay. I also wanted to ask about maybe to do fat dissolving in this area. What would you?
Yeah.
Would
For
you-
the double chin area, yeah, I would recommend you doing.
How long does it take until it's effective for it to show that, like?
It's for each patient. It's different. Yeah, but I think maybe 3 sessions. For you will see good results for the double chin area.
Will it leave my skin saggy?
No, we have some products with lifting ingredients inside with the fat dissolving material, so it won't lift the skin saggy at all.
And on a scale of 1 to 10, how painful do you think it is?
No, it is not painful like before products because it has a bit of lidocaine inside, so it's not painful. Patients even sometimes do it without any numbing cream as well.
Okay.
So no worries. Yeah.
And my final question, will I be swollen after doing it?
Hopefully not. You may, from the injection sites, you may have some swollen areas, but not much like before. The new products nowadays has like anti-inflammatory ingredients which will make the swelling and the redness much less than before. So some patients will not have any swelling and some patients will have a little of swelling at the area, so no worries.
some of the questions that we've been asked, especially by our listeners, is how, on black skin, if they're injected, will they get black marks from the injection site because we hyperpigment?
No, this may happen with lasers mostly, but not with injections. I didn't see this with my patients before. Yeah.
Okay.
If the area is inflamed for a reason, or for example, I had acne and it caused post-inflammatory hyperpigmentation after, it may be due to inflammation or something, not due to injection. You will have dark spots. I didn't see this in my life, no.
Is that even if you do microneedling on dark skin? So dark skin and microneedling, do you get PIH, post-inflammatory hyperpigmentation?
No, anyone can get post-inflammatory hyperpigmentation, but I don't think with dark skin they cannot do microneedling. They can do microneedling, they can do laser, but the proper laser and the proper treatment should be decided by the doctor.
Can you develop keloid?
Keloid is something genetic, so if you have the genes of keloid, you will develop keloid. If you don't have these genes, you will not develop keloids.
Okay. So in the past, Tiffany and I have spoken, and she said that she's used skin brightening creams on her skin. So she wanted some advice on, is that something she should be using or should she stay well away from it?
According to what skin brightening cream?
I've been using skin bleaching creams.
Hydroquinone,
Okay.
high
And,
percentage.
Under the table. Yeah, so In the past, I've used obviously skin bleaching creams. I don't know if you remember the last time when I came to do the IV drip, my skin was really, really bad and really burnt from using the tretinoin and mixing it with hydroquinone.
Okay.
So I
want advice.
Yeah, I know that, but I wanted to know if there's any safer way of having my skin lightened,
brightened.
Like,
yeah, there are many ways. Like there are some injections, local injection to the area to make it rejuvenated and brighten it up if you have a bit of pigment somewhere. Yeah, but not to lighten or whiten the things up. Yeah, so if we have pigmentation some places, we can do different procedures like injections, lasers. There are different, even topical things with Rola, like vitamin C and things, but not to use bleaching creams at home or something like this, especially hydroquinone. It's not for your skin type right now at all, yeah? Or it should be used under doctor prescription with caution.
And in terms of like, if I wanted like glass skin and anything like, you know, when your skin is like really like shiny, is there anything that I could get for that? Because I know with the tretinoin, that was what was helping me achieve glass like skin.
But the percentage you used was quite high. You used 1%, and there is options to get 0.25 and 0.1. So those are better. Glutathione IV drips are really good for brightening the skin and evening out skin tone. What do you think about glutathione IV drips, doctor?
Yeah, in terms of the proper concentration, and the proper schedule, like not 1 or 2 sessions, it may help with vitamin C in rejuvenating and brightening the skin up. Yeah, but there is nothing, like no one is 100% perfect, so it's not like glassy face or something. No, the face, if it is rejuvenated, youthful, that's it. No need to be perfect. No one is perfect.
But we strive to be.
Yeah, we strive to be. We strive to be.
Yeah.
So do you feel like wanting these glass skin or doing the extra lips, do you think it's regarding body dysmorphia or?
I would say maybe the lips is definitely body dysmorphia, because you guys both feel like I shouldn't add more because they're already big. But to me, I don't think they're big.
You don't see them, they're big?
I don't think they're big. Like, even my own mum said to me, "You're not natural, your lips are so big." I don't feel like they're that, they could be, I've seen bigger, like it could be bigger.
But then have you seen them on someone else? So maybe the lips look bigger because they were naturally born with those?
No, because they've got them done.
Really?
Yeah.
More than 8 mils?
I don't know how many mils, but they were massive. And I was thinking, yeah, I like that. I was thinking, I like the look. Like I explained before, I like the fake or artificial look. So
yeah, that's fair. So, but then in terms of doing fat dissolving under the chin, so what is your lifestyle like? Do you go to the gym? Do you work out? Do you have a healthy diet?
I used to go to the gym regularly. I need to get back into it. It's been like 3 months I fell off the wagon.
Okay, that's fair.
Yeah, I need to get back into the gym. In terms of my eating habits, I wouldn't say I'm like a healthy eater, no, because the way my diet is, it wouldn't be like advised. Like I cut my hours from eating and stuff like that, or like I'll eat today and tomorrow I won't eat for like 2 days or 3 days, and I'll go into like a water diet.
Really?
Yeah.
Oh, that's impressive. So based on her diet, Dr. Rola, do you think fat dissolving she'll get results from?
I mean, we need to change our lifestyle a bit, drink lots of water, exercise, and maybe she will benefit, yes.
So could she do the treatment today and get some benefit?
She can.
What about my chin?
So
can I add some on there?
No, we should start with this area first, and maybe your chin will be okay when we do this area. So the jaw will be defined after some sessions. So maybe we will not need to add in the chin. It's according to the response and the process. Yeah.
Okay. And you advise for me to get results, I would probably need about 3 sessions.
3 sessions, hopefully, to see some results, yes.
So is this with the current Was this with the lemon bottle, or is there another product that you think she would benefit from more?
I think baby serum will be the product for you. Yeah.
What
It's
is lemon
better.
bottle?
So lemon bottle is a fat dissolving product that seems to have blown up the internet at the moment, and it's pain free. It doesn't tend to have the inflammation that you get when you do like a product like Aqualix, but Dr. Rola's recommended an alternative product of baby serum. Why baby serum, Dr. Rola? What's the difference between them?
Because it has fat dissolving, and it has lifting, and you need both because we have a bit of double chin area here. If we did fat dissolving alone, the area will go lax. Yeah, so we need something to lift the chin and define the jawline.
Yes.
So baby serum will be the best thing to do.
Okay. Perfect. Did you have any other questions you wanted to ask the dermatologist while she was here?
I think I'm done, you know. I don't know. Do you know me, you know all my treatments, what have I done?
I just think, don't bleach your skin. You're so beautiful as you are. And I just want our listeners to know that bleaching skin really damages the membrane of your skin. Dr. Rola, actually, while we're on that subject, could you tell our listeners why they shouldn't bleach their skin and the risk it poses, not just to their skin, but to their body as well?
It's like it causes irritated, sensitive, hyperpigmented skin. So we may reach a point that we cannot treat the patient anymore with anything. So we should think 100 times before using these products.
I would want to ask, so you see for somebody who has been bleaching their skin and like I don't know if you remember how my skin was, but remember I had like the red burning kind of marks and stuff. I'll send you a picture so you can add it. Yeah. What would you sort of like recommend for that person, for that like burning skin from tretinoin and hydroquinone?
Yeah, a visit to a doctor.
Well, you heard it here, guys. If you've got red skin from bleaching your skin, visit your dermatologist because there is probably treatments and advice they can give you to help treat your skin before it gets too bad. If you use bleaching creams for far too long, there can be a stage in your life where the skin becomes so dark in the areas you've been using the bleaching creams that bleaching creams will no longer be able to treat it. You do need to see your dermatologist at this point, and they may recommend stuff like IV drips or lasers, probably lasers to be fair. Why would you say lasers would be the best for those types of patients, Dr. Rola?
According to the case.
According to the case.
Yeah. Each skin is different, so we judge and we give the decision according to each patient differently. Yeah.
Okay. Would you advise skin peeling?
I advise skin peeling for some patients. Again, it's according to the case. Who is the best candidate for skin peeling? Who is the best candidate for laser? Who is the best candidate for
what makes you a good candidate for skin peeling?
Like let us say type 4 skin, type 2, 3 skin. Yeah. If I need, for example, for type 4 or 5 to do like knees and elbows, they are hyperpigmented. We can go for peeling.
Okay.
So it's again according to each patient individually.
Would you advise peeling for people who have acne?
There is a certain type of acne peel. Yeah.
Okay.
So there we have it, guys. Dr. Rola's advised Tiffany not to do any more fillers on her lips for now. So we will do a treatment where we're going to be using the product along this part of your chin, just so we can, this part, as in people who are listening.
My other chin.
along the double chin. Cut to Tiffany getting her treatment done, and we'll come back and ask Tiffany how it went.